It's on? Oh, okay. Hi, I'm Steve Sosebee, President and CEO of the Palestine Children's Relief Fund, and I want to welcome everybody in the New Jersey chapter to tonight's event. I apologize for not being able to make it. Unfortunately, I've been unable to get out of Palestine for this event, and I'm very sorry for that. But I do very much appreciate everyone's support for the PCRF and for the work we're doing here in Palestine. And I want to give you guys a tour of the cancer department, which you helped to build, and to thank all of you for supporting our work over the years and for making the PCRF one of the most important and most effective organizations working on the ground here in Palestine. I'm going to show you the cancer department here in Beit Jala Hospital that was built in my wife's name, Huda Masri. And as you know, Huda, many of you knew my wife, God rest her soul. And that she was a great woman, and this was a way for us to not only to honor her as a great woman, also to give support for the Palestinian children with cancer, and to show people that you can make a difference and that individuals working together can have an impact here on the ground in Palestine. So the New Jersey chapter has been very instrumental. I want to thank in particular Nora Winston and her husband John for supporting PCRF for so long and being a great leader in the community. And like me, she's not Palestinian by birth, but her love for Palestine and her love for justice here shows that this is not just a Palestinian issue, it's one that any human being can support and believe in. So I'm going to go and walk around the department and show you guys the work we're doing. This area here is just a hallway from the entrance down to the patient's room. The artwork was done by Rana Bishara, who's here today, but I don't see her around right now. She's a great artist from northern Palestine, and we wanted to make it really colorful and really something special, different from any other hospital department in all of Palestine. We're very proud of that. This is the admissions desk here, where patients come into the department and they are put into the system, of course, and we have a nurse working here. This is the outpatient department here. When you come into the entrance, you come down this area, you see the memorial for Huda. It has her short biography. And then we have our kids who come in just for the day for treatment, to get chemotherapy, and mashallah, Malika, she's waving to you. And to get the outpatient treatment. Before we built this department, these kids would have to go across checkpoints and go to hospitals outside of the Palestinian public healthcare system to get treatment, and the impact and the struggle that they had to go through politically and logistically and economically was a great burden on their families, and more importantly, a great burden on the children. So now this department being in Palestine and being under the Ministry of Health enables these kids to have access, and it's less of a burden. So in this area, أهلا وسهلا. شو اسمك كمان صحتين؟ أنا آسف. أنت صحتين. شو اسمك أنت؟ محمد؟ قديش عمرك أنت؟ 9 هيك؟ ما شاء الله. من وين أنت؟ كليل. وأنتي حبيبتي من وين؟ كليلي كمان؟ ما شاء الله. طيب. We have here in this area, this is the outpatient department, and we have 2 isolation rooms here where we built, which are separate from the other areas, because kids, you have to go through 2 doors to get in here. It's kids who have a compromised immune system and cannot fight simple colds, are not mixed in with the rest of the population, so they're isolated, and this gives them a better chance to fight the disease. I wanted to just put this small message we had on the wall here, and it just was something we wanted to make clear to everybody, that this was a gift from the Palestine Children's Relief Fund to the Palestinian people as a way to ensure that every child with cancer gets the best care possible, regardless of politics, religion, race, gender, or ethnicity. This is a department of healing, love, and kindness, and this is a message we want to spread throughout Palestine. I think, our cause for justice here in Palestine is based on truth, and it also is based on love and compassion, and that's how we're going to continue to struggle and to win freedom for Palestine. We built here a pharmacy, and Hi Khalud, our head nurse تفضلي. هاي فيديو لنيو جيرسي. كيف حالك؟ كيف الديبارتمنت؟ Excellent. She's very hard working. We love Khalil. Thanks for PCRF and the New Jersey chapter. Thank you. This is our pharmacy. We built a pharmacy here. That's also where they mix the chemotherapy and mix the drugs for the patients. And we have a full-time pharmacist. I don't know where she is right now. But you don't have to spend too much time in there. You can see that these rooms were all built. The way we raise the money for these rooms is by donations from people, and then we acknowledge them. This is the outpatient department here, where we have procedures for patients like bone marrow biopsies and things that doctors need to do as a medical care. This is where they come and they get the care. Yeah, معلش آسف. So Jala, Eloise. So this department was opened officially on April 6, 2013, and before we built it 2 years ago, this was the roof of the hospital. This was open, it was full of garbage, and it was not a very impressive area. We built it and made it into a very beautiful department, and this is part of how we did it, was through campaigns where people climbed Kilimanjaro and people rode motorcycles and ran marathons. And we're very also proud that our chapters, like the New Jersey chapter, played an instrumental role in building this department. It's something like 40% of the funds were also raised by volunteers in our chapters, and we appreciate that. So here's the area where we have our patients' rooms, and you can see we tried to make it a theme. It's Arabian Nights. So each room has like Ali Baba's room, and Joha's room. And each one is donated by different groups who paid the money for us to build it. This was all privately funded, this department, and it's the largest privately funded project for the Ministry of Health. All of the other projects that they do here are through governments or through large Saudi government or the USAID or the Europeans. This was done by PCRF, and it was all done by private donations. We're very proud of that, and it shows we don't need to depend on governments with political ties and political strings to support Palestine and to support Palestinian children. The only strings that are tied to this department are the ones I mentioned before. Any child who's sick, doesn't matter if they're Christian or Muslim, doesn't matter if they're from Gaza or the West Bank, they are free to get treatment here, the best care possible. We have a nice roof here with the sky. We don't want the kids to feel isolated. We don't want the kids to feel like they are in a hospital. We want to make it as pleasant as possible. Across the top is the donation, the people who gave money to different amounts. Across the top is donations, and we're trying to make this department to keep up with it and to continue to support it. So here we have a very beautiful playroom, and it's the only playroom in any hospital in all of Palestine for kids. This is the only playroom, and in this department we have birthday parties for kids. We have someone come in and read stories every day. We have clowns come in. We have volunteers come in and play. So it's an area that really enables the kids to get out of their rooms and get treated. This is Isabel from Sweden. يختي استني شوي. شو اسمك انتي؟ هيو الكاميرا. شو اسمك؟ قديش عمرك انتي؟ 5 سنين. 5 سنين من وين؟ يلا غني شوي غني
يا الشوارع الحمراء الناس الرمالة ضد المان طلت يعود الريحان يجين نزلين ضد الواني تيس شي حلام ما شاء الله
حبيبتي. لا خلص بكفي. حلوة كتير. يا رب. استنى شوي. She wants to sing for you. ما شاء الله حلوة كتير انتي وغنية منيح. Yeah, mashallah. So this little girl is from South Palestine and Hebron area. We have computers for the kids to play games, televisions, books. So this is really the only department like this. Marwa is our social worker here. We have our doctors. We have a doctor's meeting room where they review patients. We have other areas there for the mothers to make tea and to have a chance to get away. And it's a full comprehensive department. I'll just show you a few last things. Sorry. Naveen is our full-time social worker here in the department as well. So basically we welcome anybody to come here, and we welcome anybody to support the department by volunteering. And we just want to thank the New Jersey chapter, thank Nora and everybody there who's been supporting PCRF and making this possible. This is an example of our work. This is how your money translates into healing kids like Rasha, this beautiful little girl, and having an impact here on the ground in Palestine. Politics is one thing. We all love Palestine. We all want Palestine to be free. We want the occupation to end. We want to show our solidarity with people under occupation or Palestinian refugees living outside, and to show them that we care, and this is how we're doing it. Words are one thing, but action is something else. And this is a way that we've shown action, and we show that we are going to keep supporting Palestine through love, through healing their children, and showing them that they're not forgotten. So thank you, the New Jersey chapter. We appreciate it very much, and we hope that you'll continue to support our work and make our work possible, because there's so much more work here to do. There's so many more kids who need our help, and there's so many more things that we want to do, but we need you guys to make it possible. So I'm sorry I can't be there tonight. I wish I could, but as you can see, I'm not on vacation. I'm here in Palestine doing my job, and it's an honor and a privilege to do this work. And I really want to just show you that we are doing our job, and we will continue to work until Palestine is free or there's no need for PCRF. So thank you guys. Good evening.